Gauteng health facilities are starting to feel the impact of these prolonged power cuts. Our reporter Linda Mnisi visited the Far East Rand Hospital to assess the situation there.
Stage 6 load shedding has had Gauteng hospitals on life support. When Eskom pulls the plug, facilities run on generators, allowing life-saving to continue uninterrupted. This facility was thrown a different curveball on Saturday when power went off.
We had a power outage which was resulting from a power station failure in the local area here, which led to our generator kicking in, which is what happens when there is no power. Generators are supposed to kick in when there is no power, but for a limited period of time. In this case, our generator was running for the whole night of Saturday up to Sunday morning around 9ish, where one of our generators ran out of diesel. We have actually 2 generators, but what is most important with this generator, this is the one that supplies our critical areas in the hospital, which is our ICU, our theaters, our casualty area, which led us to inviting the supplier of diesel to come and fill our tank of the generator.
These generators only run for between 3 to 6 hours. The hospital has an agreement with the local municipality which exempts it from load shedding. However, Linda Mnisi says they were told that there was a cable fault at a local power station which resulted in prolonged power cuts.
I think we're very lucky that we didn't lose a life. I can state that our ICU was full. We had patients in casualty, but of critical importance we had a patient that we had in theater that was being operated when the power went off. But luckily enough, we didn't lose any life. But it is indeed, it emphasizes the importance of hospitals being spared. But in our situation here, as I said earlier, we have an arrangement with municipality. We are not being load shedded as Far East Rand under scheduled load shedding. But in this case, we are affected because there was a fault of the power station itself.
The Gauteng Department of Health says all hospitals in the province are at the mercy of these generators during power outages. Prolonged power cuts mean hospitals must quickly refuel diesel to continue operations.
What we've done provincially is that we've ensured that there's regular maintenance now of the generators as a way of making sure that we've got that backup capacity. The issue around diesel supply, I know that in the past we've had challenges in terms of security of supply. We have dealt with those particular challenges to ensure that at least we're able to regularly continuously supply diesel to the facilities, and there's also uninterrupted power supply systems that some of these hospitals would have, but those are stopgap measures that take you for a shorter period of time.
Mudiba says further engagements will be had for more facilities to be exempted from power cuts, but concedes a long-term solution is needed.
You know that the provincial government, through the MEC for Treasury, did announce in May during the budget vote that there is a program of solar power which is going to start with about 11 facilities. And I think that in the long term maybe might assist in terms of alleviating some of the pressures, but in the short term, we have to make do with the current reality that we find ourselves in. And our clinicians at facility level have to always make decisions that would then obviously be in the best interest of patients. What that means is that sometimes you are having a situation where you say elective surgeries which are more scheduled and so forth might have to maybe delay a bit so that you focus on those cases that are emergency, your cesarean births and other emergencies that cannot wait. You have to then prioritize those.
With the challenges that now go beyond agreements with municipalities, the department urges the public to exercise patience as it tries to find lasting solutions to the power woes threatening the lives of its patients. For Newzroom Afrika on Channel 405, I'm Linda Mnisi in Ekurhuleni.